Hey guys, welcome to another question of the day. Today's question has to do with breast implants versus a breast lift. And a patient asked me, I want to have a breast lift, do I need to have an implant as well? That really is a great question because that's going to enable me to launch into a couple of different topics here. I want to talk about breast implants and what they can do for you, and let's talk about a breast lift and what that can do to you. In order to do that, I'm going to grab one of my props here. I'm going to grab a breast implant. So let's first talk about breast augmentation. The purpose of breast augmentation is to take a breast that's small, that someone's not happy with, and enhance that breast with more volume. So when you think of an implant, you should think of an implant in terms of adding volume to a breast. They don't necessarily shape the breast, but they add volume back to the breast. So now let's talk about a breast lift. Why would we do a breast lift versus having a breast implant, and how do we combine the two? A breast lift is for a patient who has a lot of loose skin in the breast and the breast tissue is very lax and it's hanging. Usually in that case, the nipple is well below the breast crease, and that's what we're looking at is the breast fold and where does the nipple sit relative to that fold. When the nipple is drooping below the fold, that generally indicates that we need to tighten up the skin envelope and lift the breast to give you better shape. So what would an implant do for you if you needed a breast lift but you weren't sure whether you wanted an implant or not? If you have a breast lift, there's really only a certain position that we can elevate the breast to, in which case we can't elevate it anymore. Unfortunately, here on planet Earth, we have gravity. When there's gravity, gravity wins, and things tend to hang lower with gravity. If you're on the space station, you'd have a perfect breast lift. It would never sag. But what people want a breast implant for, usually in conjunction with the breast mastopexy, is this. The implant will give them upper pole volume. So if you desire that nice round shape to the upper part of your breast, a mastopexy or a breast lift isn't going to do that alone. Initially, it will be tight enough and high enough, but as I told you, gravity starts to win and things start to sag and give a little bit. What a breast implant does for you in that case is adds volume to the overall breast, but more importantly, on the side view of a patient, they want that nice round shape to the breast. So a lot of times when I see patients for mommy makeovers and they've breastfed and they've had multiple children, they have a lot of loose skin and the nipple is hanging well below the fold. They want more round volume and they want to be lifted. In those cases, most of them, we're doing a breast augmentation with a breast lift. This all depends on what your anatomy is like when you come to the office. You might be a candidate for just a breast augmentation alone and an implant. You might be a candidate for just a mastopexy alone, or you might be a candidate for both. That all depends on what you want and what your goals are. So I hope that helps answer your question. Again, you guys ask the question and I will answer it. Have a great day.